So, who needs scans and imaging and who does not? And in particular, why is PET scan not always the best choice?
Most people do not need any type of imaging, including an X-ray or a CAT scan or another test known as a PET scan. These are all different modalities or different ways to look inside an individual. And really what we're looking for is there any evidence of spread of that cancer? Because most skin cancers remain right at the area that they were identified, so we call that the local area, removal of that skin cancer will occur right at the site. So for example, if you've had a skin cancer on your arm, then the removal of that skin cancer will be localized right to that arm. So there really isn't a need to look inside to determine whether or not the cancer has spread. For individuals that may have a worrisome, for example, a squamous cell cancer that typically are on the head and neck, if there is concern that squamous cell cancer is high enough risk that it may have spread to lymph nodes in the area, or if there's concern that it may be in an area that would make fully removing it by surgery difficult, then imaging is often necessary. For example, a physician may request scans, a CAT scan of the neck or the head, so that they can better visualize the extent of the skin cancer in the local area. And it will help them determine what the best treatment is. If the CAT scans suggest that surgery may be difficult, then there may be different treatment options discussed. It may be that individual does need to go to medical oncology and have a discussion about some type of systemic therapy, or it may be that the recommendation would be not surgery, but perhaps radiation, which is an X-ray type therapy, or a combination of the above. If there is an individual that is very high risk, for example, could not have surgery because perhaps they can't tolerate anesthesia or something like that, then they may need some type of CAT scan to further determine the extent of the tumor and what the treatment options would be. CAT scans, for the most part, are what we consider to be gold standard for advanced melanomas or squamous cell, meaning that's the go-to test to be able to assess the extent of the tumor and where the tumor may or may not have spread. Sometimes a PET scan will be requested. And a PET scan is just a different way to look inside an individual. Essentially, with a PET scan, somebody has an intravenous put into their arm. There is sugar or glucose injected into the veins. And that glucose would go to an area in the body that requires a lot of energy. Tumors, sometimes energy is needed if you have a bad knee because you have arthritis or there's some infection in the body. That part of the body, that area that needs that energy, will pull up that glucose, and that glucose is connected to a radioactive material, which lights up on a PET scan. These are completely safe, very safe, and excreted by the body within a day or two. So they're safe to use, but these tagged molecules of sugar will light up on a scan and show where there may be an area in the body that is using up this energy. And it can help the physician team determine whether or not there has been spread of the tumor. Now, PET scans sound wonderful, and they are wonderful, but they're used only for very particular instances. For example, if there is an abnormal finding on a CAT scan that's just not quite clear and the physician team is not sure what that is, they then may request a PET scan. But PET scans are challenging to give somebody who has uncontrolled diabetes because that's a sugar problem. And so PET scans are wonderful in certain instances, but for the most part, CAT scans are what are considered gold standard. And we would not look at the brain or the head area as closely with a PET scan because the brain pulls up that glucose. The brain needs a lot of energy. And so it's not always a great picture on the PET scan for a skin cancer that may be located in the head area. So often CAT scans are the better test to be able to look at skin cancers that are in the head and neck region. It really is a discussion that should be had with the physician team. And if a certain test is recommended to you and you don't understand why, then absolutely ask your team what the reasoning is to get the test that they're getting, because you have a right to know and you have a right to understand why certain tests are being requested and why certain tests are not being requested.